John Smith, 51 years old, married with 2 children, is on a business trip in Brussels. While in a meeting, he suddenly feels nauseous, breaks into cold sweat, and he has severe back pains. When he begins to lose consciousness, his business partners call an ambulance that takes John to the hospital. The business partners inform John's wife Sophie in Texas, who immediately gets on a plane to join her husband in Brussels. John is taken to the emergency room, and in order to relieve the pain and be able to examine the patient, the emergency doctor administers a painkiller. John is responsive but increasingly drowsy. He mentions strong pains in his left abdomen and his back. When asked about an old scar on the right side, has no specific memories. An ultrasound scan and x-rays are performed on suspicion of a renal colic. The lab results show a significant increase in the kidney function. Meanwhile, John's condition is worsening. Sophie, John's wife, an authorized user in John's WoMBA, authorizes John's doctors as well as the facility treating him to access his medical data that are stored in his personal WoMBA health record. His medical history has been automatically translated into French, and so the doctors find out that 15 years ago, John's right kidney had to be removed due to an arterial occlusion of the right kidney. This crucial information points the doctors in the right direction. The contrast medium images of the arteries reveal an acute arterial occlusion of the left kidney. Less than half an hour later, John is on the operating table and the embolus in the kidney artery can be removed. The left artery is saved, and John is spared many years of dialysis treatment. 1 week later, John leaves the hospital, supported by his wife. The doctors have uploaded his hospital treatment data to his WoMBA record. Based on the indexation and ICD-10 coding of the data, an automatic translation of the most important structured data into multiple languages can be performed so that Dr. Cohen, John's family doctor, who also has access to the personal health record, can prescribe blood thinning medication to help preventing another arterial occlusion. In the course of the subsequent medical examination, Dr. Cohen noticed in the lab sheet that his patient is in the critical stage of prediabetes. He discusses the next steps with John in order to prevent the outbreak of diabetes. Furthermore, Dr. Cohen prescribes blood pressure-lowering medication and records the prescription and administration in the digital medication plan of John Smith's health record. John and his doctor can now entirely rely on WoMBA and start a close monitoring of John's therapy. WoMBA offers interfaces with devices for measuring blood pressure and sugar, digital scales, etc. These vital data are directly transferred to the health record of Mr. Smith and can be retrieved in real time. John is overweight, does little exercise, and consumes too many carbohydrates. John and Dr. Cohen can now focus entirely on the doctor-patient consultation. At home, John logs into his WoMBA and reviews all the notes and realizes that going forward, he must take care of himself so that he may enjoy a long life. John and Dr. Cohen agreed to follow up with video consultations via the WoMBA application, UrgeDoc, to adapt the treatment if needed. With the help of WoMBA, John can now manage his health long-term together with his doctors as utilizing modern technology.